Good morning dear friends and students. എല്ലാവർക്കും Diyas Nursing Corner Ideas and Tipsലോട്ട് സ്വാഗതം. എല്ലാവർക്കും സുഖാണെന്ന് വിശ്വസിക്കുന്നു. ഇന്ന് നമ്മൾ ഡിസ്കസ് ചെയ്യാൻ പോകുന്നത് Part-5 MCQs ആണ് from OBG subject. അപ്പോൾ നമുക്ക് ക്വസ്റ്റ്യൻസിലോട്ട് കടക്കാം. Question number 1. Dash is a condition that results from deposit of unconjugated bilirubin within the brainstem and the basal ganglia. Option A jaundice, option B hemolytic disease, and C diabetes, and option D kernicterus. Here the correct answer option D kernicterus. Next question. Question number 2. When it is present at birth, babies may need to undergo stretching the shortened neck muscles on the affected side. Option A cleft lip, option B Erb's palsy, and C torticollis, and last one D Klumpsky's palsy. Here the correct answer option C torticollis. Next question, question number 3. Short palebral fissures are seen in dash condition. Option A diabetes, and option B RH incompatibility, and C convulsion, and last one D fetal alcoholic syndrome. Here the correct answer option D fetal alcohol syndrome. Question number 4. Infant born before 37 weeks of gestation is called option A term infant, option B preterm, option C SGA means small for gestational age, and option D LGA large for gestational age. Here the correct answer option B preterm. Next question, question number 5. One of the following is not absolute contraindication for dilatation and curettage. Option A viable desired intrauterine pregnancy, and option B inability to visualize the cervical os, and option C obstructed vagina, and last one option D severe cervical stenosis. Here the correct answer option D severe cervical stenosis. Next question, question number 6. Postpartum endomyometritis is one of the complication for option A Cesarean section, and option D amnio infusion, option C D and C, and option D D and E. D and C dilatation and curettage, D and E dilatation and evacuation. Here the correct answer option A Cesarean section. Next question, question number 7. Abnormal uterine bleeding is a diagnostic indication for A D and E, and B D and C, and C evisceration. Here the correct answer option A D and E dilatation and evacuation. Next question, question number 8. The operation that consists of the reduction in the bulk of the shoulder girdle by the division of one or both the clavicle is called option A evisceration, option B amnio infusion, and C cleidotomy, and D craniotomy. Here the correct answer option A evisceration. Next question, question number 9. Which of these causes for secondary dysmenorrhea? Option A urinary tract infection, option B respiratory tract infection, and option C endometriosis, and last one option D hereditary. Here the correct answer option C endometriosis. Question number 10. A condition where the menstruation occurs but it is not visible due to an obstruction of the outflow tract. Option A cryptomenorrhea, option B dysmenorrhea, and option C endometriosis, option B DUB or dysfunctional uterine bleeding. Here the correct answer option A cryptomenorrhea. Sorry dear friends, question number 11 is missing. Next question, question number 12. Providing relief from the cramping pelvic pain and associated symptom is the aim of treatment for option A UTI, option B secondary dysmenorrhea, option C cryptomenorrhea, and option D, primary dysmenorrhea. Here the correct answer, option D, primary dysmenorrhea. Next question, question number 13. Biopsy finding shows proliferative or dyschronous endometrium. Option A, dysmenorrhea. Option B, dysfunctional uterine bleeding. And option C, cryptomenorrhea. Last, option D, amenorrhea. Here the correct answer, option B, dysfunctional uterine bleeding. Next question, question number 14. Bloating, breast tenderness are the common symptoms of dash. Option A, premenstrual syndrome. Option B, dysmenorrhea. Option C, uterine polyps. Option D, cryptomenorrhia. Here the correct answer, option A, premenstrual syndrome. Next question, question number 15. IUI stands for. Option A, in vitro uterine insemination. Option B, intrauterine insemination. Option C, interuterine infusion. And option D, intrauterine injection. Here the correct answer, option B, intrauterine insemination. Next question, question number 16. ICSI stands for. Option A, intracytoplasmic sperm injection. Option B, intracystic semen infusion. Option C, intercystic infusion. And option D, intracytoplasmic semen infusion. Here the correct answer, option A, intracytoplasmic sperm injection. Next question, question number 17. The procedure where the number of embryos are transferred to the uterus several days later using US guidance for the best placement is. Option A, egg donation. Option B, egg retrieval. Option C, embryo transfer. And option D, oocytes retrieval. Here the correct answer, option C, embryo transfer. Next, 18th question. HSG is expanded as. Option A, hormonal salpingogram. Option B, hysteroscopography. And option C, hysterosalpingography. Here the correct answer, option C, hysterosalpingography. Next question, question number 19. Crohn's disease is a predisposing factors for dash condition. Option A, oophoreitis. Option B, vulvitis. Option C, vaginitis. And option D, pelvic abscess. Here the correct answer, option D, pelvic abscess. Next question, question number 20. Overgrowth of yeast can result from dash in vaginal moniliasis. Option A, antibiotic use. Option B, antifungal use. And option C, antiviral use. And last one is none of the above. Here the correct answer, option A, antibiotic use. Next question, 21. Butoconazole is an effective in the treatment of dash. Option A, oophoreitis. Option B, salpingitis. Option C, vaginal moniliasis. Option D, trichomoniasis. Here the correct answer, option C, vaginal moniliasis. Next question. Gonorrhea is a dash condition. Option A, PID, pelvic inflammatory disease. Option B, STD, sexually transmitted disease. Option C, GID, gastrointestinal disease. And option D, unclassifiable disease. Here the correct answer, option A, pelvic inflammatory disease. Next question, question number 23. Sores or bumps on the genital or in the oral or in the rectal area is indicative of. Option A, STI. Option B, UTI. Option C, PID. And option D, URTI. STI means sexually transmitted infection. UTI, urinary tract infection. PID, pelvic inflammatory disease. And URTI, upper respiratory tract infection. Here the correct answer, option A, STI. 24th question. UFE stands for. Option A, ultra frequency embolization. Option B, uterine fibroid embolization, and option C, urinary fiber embolization. Here the correct answer, option B, uterine fibroid embolization. Next question. Question number 25. The tumors that are not likely to invade and spread are called tumors with dash. Option A, high malignant potential. Option B, high motility potential. And option C, low malignant potential. And option D, low motility potential. Here the correct answer, option C, low malignant potential. Next, question number 26. Mass that is unilateral, cystic, mobile, smooth are most likely to be dash tumors. Option A, benign. Option B, malignant. And option C, mixed. Here the correct answer, option A, benign. Next question. Question number 27. The tumors that typically have a lobulated smooth surface are option A, cystic teratoma. Option B, follicular cyst. Option C, serous tumors. And option D, mucinous tumors. Here the correct answer, option D, mucinous tumors. Dear friends, ഇതുവരെയാണ് ഞാൻ ഇന്ന് പ്രിപ്പയർ ചെയ്ത് വന്നിട്ടുള്ളത്. എല്ലാവർക്കും ഇത്രയും ക്വസ്റ്റ്യൻ യൂസ്ഫുൾ ആകുമെന്ന് വിശ്വസിക്കുന്നു. Thank you for watching and supporting me. Have a nice day. Once again, thank you all.